Good evening, Bahamas. I'm Christina McNeil, and this is MB12 for Thursday, August 2nd, 2012, broadcasting from the Cable 12 studios on Robinson Road. In news tonight, the Minister of Health addresses an expanding bacteria outbreak at Princess Margaret Hospital. A closer look at what's included and what's missing from the latest crime statistics. Government responds to a double credit negative rating by Moody's, and when you can catch Bahamians on the Olympics again. We have those stories and much more coming up tonight. Your MB12 starts right now. Thanks for joining us. Minister of Health Dr. Perry Gomez today confirmed that additional cases of a deadly bacteria infection have been detected in other parts of the hospital. Dr. Gomez also revealed that an investigation will be launched into how the entire outbreak was managed. Jasmine Bonamy has the details.
While a deadly bacteria was first discovered in the neonatal ICU at PMH 3 weeks ago, an additional 5 patients from another ward have tested positive, and hospital officials are still clueless as to what caused the outbreak. On Wednesday afternoon, our news team was reliably informed that the bacteria had spread to the general intensive care unit. But when we asked Dr. Gomez yesterday, he denied the reports. But in the House of Assembly this morning, he confirmed the new cases of Acinetobacter bacteria infection.
As a result, as of yesterday, 5 new cases were identified, this time in the general intensive care unit of the Princess Margaret Hospital. Those affected, 4 adults and 1 child. None of them is ill.
But outside the House today, Dr. Gomez insisted that the bacteria did not spread from ward to ward. He claimed the new cases were found in people who already had the bacteria within their system before they were admitted to PMH's ICU sometime on Tuesday.
All 5 of them came from the community into the hospital and admitted to the hospital. It's okay, and on routine screening, which we have put in place because of the outbreak downstairs, they were discovered to be carrying the organism. You see, they're not sick. They're what is called in medicine, they're colonized with the bug, but not sick from it. That's how organisms get into the hospital too, you know. So it's not a spread throughout the hospital. That's not correct.
In the last month, 2 babies have died and 6 others were infected with the waterborne bacteria as health officials try to track down the source. This is not the first time such an outbreak occurred in the Bahamas. In August 1996, 8 infants acquired Acinetobacter bloodstream infection while at PMH. 3 infants died that year. Just like the last outbreak, PAHO officials are monitoring the situation.
A recent report compiled by PAHO on infection control policies in the 3 hospitals of the Public Health Authority and released in early June 2012 identified a number of offending practices. The report indicated that some of the corrective actions suggested as a result of the 1996 findings were systematically terminated.
The outbreak has sparked much public interest, with Dr. Gomez coming under fire for not publicly addressing the deaths before last Friday. But today, Dr. Gomez has accused opposition leader and MP for Killarney, Dr. Hubert Minnis, of politicizing this very serious matter.
The member for Killarney, who was obviously provided with this information by an administration that failed to advise its own ministry of the outbreak, has sought to make political issue of this very serious matter.
Dr. Minnis stood on a point of order and said hospital administration did not inform him of the spread of the bacteria and he was not seeking to politicize the issue. Meantime, Dr. Gomez revealed the government is seeking to engage an eminent Caribbean physician to conduct a review of the investigation into this outbreak and report as soon as possible, as babies have died and someone has to be held accountable.
We wish to depoliticize this issue. Accordingly, we are seeking to engage an eminent Caribbean physician to conduct a review of the management of this investigation and to report at the earliest opportunity.
Gomez said families of all the babies in the neonatal ICU have been counseled. He also admitted that this outbreak has brought to light certain glaring anomalies within the hospital. Reporting for NB12, I'm Jasmine Bonamy.
Well, earlier this week, hospital officials outlined what measures they've taken to prevent the spread of the disease, saying the NICU, where the first cases were discovered, was completely sterilized. Government Control Officer at PMH, Mary Walker, says environmental control practices have been beefed up.
So yes, it does speak to not only their air handling systems, but also how we maintain and sanitize.
Officials believe this strain of the bacteria is water-based, although they did not say how the outbreak started and what caused it. They also did not reveal the nationalities of the babies. Meantime, Medical Chief of Staff Dr. Jeffrey Pennerman said hospital personnel are also being retrained on best practices.
Retraining has occurred in all grades of staff and is ongoing. The Infection Control Unit continues its normal surveillance activities.
Additional testing has also become routine on both the NICU and ICU units of PMH since this latest outbreak. A closer examination of newly released crime statistics has revealed that not all categories of crime were included in those figures. The Royal Bahamas Police Force failed to include 3 categories: attempted murder, attempted robbery, and stealing from vehicles. That means the statistics provided by National Security Minister Dr. Bernard Nottage yesterday are incomplete. When asked about this disparity, the minister said he simply read the statistics that were given to him. He also promised to look into the matter. Fanique Toot reports.
The number of reported attempted murders, attempted robberies, and stealing from vehicles cases have previously been included in crime statistics released by the Royal Bahamas Police Force. However, those 3 categories were noticeably absent from the crime statistics tabled in the House of Assembly on Wednesday by National Security Minister Dr. Bernard Nottage. He did not seem to notice they were missing until we brought it to his attention today.
I don't have anything. They were provided for me, so I'll check into it. So what I told you, what I've always told you is that that is the Commissioner of Police's responsibility. Because you gently asked me for them, I tried to get you what I could. And that's what I provided with you. But the Commissioner of Police indicated to me this week that he will be making a release very soon.
The National Security Minister released crime statistics for the first 7 months of 2012 after Commissioner of Police Alison Greenslade was accused of withholding the latest figures. According to NB12's records, attempted murder, attempted robbery, and stealing from vehicles numbers were included in crime statistics released by police in 2005, 2006, 2007, 2008, 2009, 2010, and 2011. That means the information tabled by Nottage was incomplete.
It means it's accurate for what is on the paper. I can't speak to the rest of it until I see it.
Attempted murder, attempted robbery, and stealing from vehicles numbers are only included on the list of national reported crimes from May to July 2012. According to data compiled by the Strategic Policy and Planning Branch of the Police Force, there was 1 attempted murder recorded between May and July 2011 and 6 attempted murders during that same period this year. That's a 500% increase. However, for some reason, a line was drawn through that category. We also discovered a disparity in the category of manslaughter. Last month, head of the Central Detective Unit, Superintendent Paul Roll, told NB12 that 2 killings were reclassified as manslaughter. However, according to newly released crime statistics, only 1 case of manslaughter has been recorded between January 1st and July 24th. Dr. Nottage says the police force may very well have to change the way it reports crime figures so that they can be interpreted accurately. He admitted that questions have arisen over how to categorize certain crimes.
For example, the questions of murder, for example, as opposed to homicide. One of the difficulties we've had in this country is that when the attempted murder statistics have been published in the past. In fact, you remember there was a statement made that we had one of the highest rates of murder in the world, I think it was. The people who made that statement were combining attempted murder and murder. and using that figure as the figure for murder in the Bahamas, which was wrong.
Former Minister of National Security Tommy Turnquest would not speculate on why certain categories were missing. However, he did suggest that crime is down as a result of the compendium of anti-crime bills passed in Parliament under the Ingram administration last year.
If Mr. Turnquest feels he would like to take credit for it, then he can do so. But I also want him then to go back and take credit for the murders in May, which they seem to suggest that were the result of the PLP winning the election. You can't have it both ways. And I'm really not concerned about who gets credit. What I'm concerned about is that the policies that we are implementing are having a positive impact in the right direction. And that is what I think the situation is now.
The National Security Minister could not say when the Commissioner of Police will release full crime statistics. However, he said they will be made public soon. Reporting for NB12, I'm Vonik Toot.
Credit ratings agency Moody's has assigned a negative credit rating for both the Bahamas and BTC's parent company, Cable and Wireless Communications, ahead of renationalization negotiations. Moody's yesterday released an assessment of the government's plan to gain majority control of BTC, an assessment that Minister of State for Finance Michael Halkitis suggests may lack credibility. Halkitis says upon reading the report of the Bahamas, it appears to be one analyst's opinion of government programs, an opinion he says has been arrived without consulting the government.
It disturbs us to the point that what we see are opinions being expressed and that are not informed by facts, all right, and so that it creates apprehension with the public, and we just want an opportunity to be able to put the facts on the table and answer any question that the analysts might have, which is the way that all the other rating agencies do things. We just think it's improper to be publishing these things without any sort of reference to the ministry. Not that we're not willing to just let the information be out there, but I mean it's just a matter of process. If you're going to comment on the government's policy, please, it would be nice to get the opinion of the government and the facts put on the table from the government of what their policies are and what they intend to do.
Halkitis says Standard & Poor's was recently in the Bahamas gathering information for its own report. While here, Halkitis says S&P analysts met with business leaders as well as members of the government and opposition to discuss government fiscal plans and policies. That's the way Halkitis says information should be gathered. To that end, he says he does not expect an agency of Moody's reputation to publish a report that appears to have been written in a vacuum. As for the controversial subject of just how much it could cost government to renationalize BTC, Halkitis says it is too early to say.
That would be premature. Right now, as you know, Cable and Wireless the negotiations are about to begin. There was, as the Prime Minister said, there was a meeting between himself and the Chief Executive. The government recently announced its negotiating team. Cable and Wireless had previously announced their negotiating team, and so they will sit down and discuss the issues. It would be premature of me to try and put any sort of figure on that.
Halkitis and other government officials are scheduled for a teleconference with Moody's analysts next week to better communicate government's fiscal plans and policies.